This segment of DelmarvaLife is sponsored by TidalHealth.
The human body, it's a fickle thing that takes a lot of work to take care of. We've got to work to keep our bodies functioning, and a big component of that is making sure that our organs are taken care of as well and are healthy.
And one of the most important organs contributing to our bodily functions are our kidneys. They help to remove waste from our bloodstream, as well as help control our blood pressure, among other things. Unfortunately for us, there is a possibility of developing chronic kidney disease. So here to elaborate on this subject is Dr. Janet Pedro. She is a nephrologist with TidalHealth. Thank you so much for being here this afternoon.
Thank you so much for having me.
So let's start unpacking this a little bit from the beginning. What is chronic kidney disease?
So chronic kidney disease is diagnosed when there is persistent abnormality in kidney function. So when the kidney function is decreased, or when there is a persistent abnormality in a urine test, like protein or blood. We can also tell if there's chronic kidney disease based on findings on a CAT scan or an ultrasound or an MRI.
Is it very common?
It's actually more common than people think. 37 million Americans are estimated to have chronic kidney disease. That's 1 in 7 adult Americans.
Wow.
So
That's
it is
incredible.
common.
Are there some symptoms to look for that might indicate it?
Usually there are no symptoms early on in the disease. We get the symptoms when it's more advanced. So we don't want to wait until the symptoms develop before we find out that there's chronic kidney disease. And the important thing is to get checked out, because we can tell if there's chronic kidney disease based on blood test, which is called the serum creatinine, or a urine test for protein and blood.
So that's the best way to proactively try to protect and take care?
Yes. So it's important to get checked on a regular basis. And there are risk factors for kidney disease: diabetes, high blood pressure, heart disease, and family history of kidney disease. So if you have those risk factors, it would be good to get checked at least once a year, if not more frequently.
Now, is there a certain way we should take care of ourselves, maybe a special diet or something to prevent chronic kidney disease?
So there are things that we can do to prevent kidney disease. First off, if you have diabetes or high blood pressure, then those are the number 1 and 2 things that you need to take care of. So follow your diet, take your medications, get yourselves tested by your doctors regularly. For blood pressure, we want to achieve a goal of less than 140/90.
Okay.
And it would be important for you to try to stay healthy otherwise, maintain a healthy weight, exercise.
So how and where can TidalHealth step in and help us maintain healthy kidneys?
So we actually have regular education classes from TidalHealth, Nanticoke and Peninsula. And if you're interested in coming to the classes, get more education, I go through the different aspects of chronic kidney disease and what else we can do to help it out.
Dr. Janet Pedro, TidalHealth, thank you so much.
Thank you so much for having me.